This is a very important point of reality. As many of us know, this pandemic has impacted us in multiple dimensions: personal, professional, emotional. For breast cancer patients, it has not been an easy past year. The way the pandemic has impacted breast cancer care is similarly multidimensional. As a starting point, we know that access to what we call essential services have been disrupted. That means that hospitals may have beds that, instead of focusing on cancer, have to be diverted towards responding to the pandemic and the need to care for patients with the COVID virus. So as a result, hospitals may not be able to provide the same complexity and timeliness of cancer care as they had been in the past. Similarly, patients had fears, either that the hospitals weren't safe, primary care providers couldn't be visited, and that also resulted in delays. As a subset of that fear, we also know that for many women, they weren't able to physically get to hospitals. It could be because of quarantine measures, lack of availability of public transportation, or simply a lack of financial access. And this added to the complexity of ensuring that women with cancer and women with breast cancer are able to get to a hospital or to a clinic to receive the care that they need. We have also seen that women with cancer broadly, and perhaps, although we aren't 100% certain of the effect, there is a biological interface between the virus itself and people who are receiving cancer care. In some cancers, we know this to be a much stronger effect. In breast cancer, we're still analyzing the data to better understand it. But there is a biological interface between the virus itself and cancer patients, particularly those that are immunosuppressed. So with this complex set of interfaces, we know that breast cancer care has been impacted globally. Some countries, though, have been able to respond, and that is an important message, that in fact, some mitigation measures, as we call them, have been successful. Whether that's the government getting involved to help women get to clinics through a navigation network, whether it is awareness programs to advise women with cancer, look, it is okay to continue in your cancer care, to be reassured, to visit your primary care provider, increased use of telemedicine and telehealth. There have been successful mitigation strategies. At WHO, we have been analyzing the impact of COVID on cancer care. Countries have reported that as many as 50% of them have experienced a partial disruption of cancer services. We've also looked in the peer-reviewed literature to better understand what are some of the precise ways that breast cancer care is being impacted, and also looking at strategies to understand how can the community respond. We've been pleased to publish on those papers and are now working on models to help governments plan for a response. As we look to build back better, an important concept here is that we can learn from the lessons of COVID to better understand how can we care for cancer patients? How can we avoid those delays or interruptions in therapy? They have been more common during the COVID pandemic, but it has also been true that they exist for certain high-risk or vulnerable populations even before the pandemic. So we can learn from our experience to build systems to meet the needs of women with breast cancer, so that while we look to emerge from the virus, we build a system that can better respond to the broader needs of cancer patients and women who continue to receive breast cancer care.